When you go to your doctor for a routine checkup or for consultation, the doctor might ask you to get your CBC done. So CBC stands for complete blood count. It is a procedure which involves taking a blood sample and further sending it to the laboratory for analysis. So a laboratory report of CBC might look like this. It will contain many information such as the level of hemoglobin, MCV, RBC, WBC. So in this video we will see what they stand for and what is their significance. So why is a CBC ordered? A CBC can be ordered as a part of a routine checkup or if you have unexplained symptoms. It is ordered to evaluate your overall health, that is in a routine checkup, to diagnose a health problem, to monitor a health problem, or to monitor your treatment. That is, say if you have a health problem and you are under medication, the next time you visit a doctor, he might ask you to get a CBC done to see the effect of medications on your health problem. So first we'll talk about HB or HBG. This test is a measure of hemoglobin in blood. Hemoglobin is an iron-rich protein in the blood that holds oxygen and transports it throughout your body. The normal range in men is 14 to 17 gram per deciliter and in women you have 12 to 15 gram per deciliter. So what if you have a value which is less than the normal range? Deficiency of HB is indicative of anemia. Anemia can be a presentation of many other causes such as iron deficiencies or other vitamin deficiencies and so on. Then you can have a high hemoglobin value which is indicative of a rare blood disorder called polycythemia. This is just one case, but there are various other causes which can result in you having a high hemoglobin value. Next is the white blood cells or the WBCs. WBCs are also known as leukocytes, which are cells of the immune system. That is, WBCs help you in fighting against an infection. In norm, you will have around 4,500 to 10,000 cells per microliter. So apart from the norm, you can have a value of WBCs which is over the norm or under the norm. Excessive number of WBCs might be due to proliferative disorders, or it can signify that you have an infection. Or insufficient numbers is usually known as leukopenia, and again it can have numerous causes. Next is RBC, which stand for red blood cells. Red blood cells carry oxygen throughout your body. They also help to filter carbon dioxide. In norm, men have 14 to 17 gram per deciliter and women 12 to 15 gram per deciliter. When RBC count is higher than normal, they call it erythrocytosis, and count can be lower than normal. Again, the reasons or the causes can be numerous. Next is HCT or hematocrit. Hematocrit represents the percentage of red blood cells in total blood volume. Normally it is around 40% for men and 31% for women. MCV or mean corpuscular volume. This is the average size of your red blood cells. The norm MCV score is 80 to 95. Platelets. Platelets are also known as thrombocytes, which is a component of blood which helps in stopping bleeding. So when you get a wound or a laceration or a cut, with time you can see there is a brown substance which has formed over the cut. So one of the factors that help in forming this substance is platelets. In the normal range, you have around 140,000 to 450,000 cells per microliter. Next is ESR. ESR stands for erythrocyte sedimentation rate, which is measured per hour. An ESR test can help determine if you have a condition that causes inflammation. So in norm, the ESR can vary from 1 to 10 millimeters per hour, and in females 5 to 15 millimeters per hour.